Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A full-term newborn was just born. Which nursing intervention is important for the nurse to perform first? 1. Remove wet blankets. 2. Assess APGAR score. 3. Insert eye prophylaxis. 4. Elicit the Moro reflex. The correct answer is 1. Remove wet blankets. When newborns are wet, they can become hypothermic from heat loss resulting from evaporation. They may then develop cold stress syndrome. The first APGAR score is not done until 60 seconds after delivery. The wet blankets should have been removed from the baby well before that time. Eye prophylaxis can be delayed until after the parents have begun bonding with their baby. Although the baby's central nervous system must be carefully assessed, reflex assessment should be postponed until after the baby is dried and is breathing on his or her own. This is a prioritizing question. Every one of the actions will be performed after the birth of the baby. The nurse must know which action is performed first. Because hypothermia can compromise a neonate's transition to extrauterine life, it is essential to dry the baby immediately to minimize heat loss through evaporation. It is important for you to review cold stress syndrome. A nurse must administer a medication. Which should the nurse do first? 1. Verify the prescription for accuracy. 2. Check the client's identification armband. 3. Ensure the medication is in the medication cart. 4. Determine the appropriateness of the prescribed medication. The correct answer is 1. Verify the prescription for accuracy. The administration of medications is a dependent function of the nurse. The primary healthcare provider's prescription should be verified for accuracy. The prescription must include the name of the client, the name of the drug, the size of the dose, the route of administration, the number of times per day to be administered, and any related parameters. Although checking the client's identification armband is essential for the safe administration of a medication, it is not the first step when preparing to administer a medication to a client. Although ensuring that the medication is available may be done as a time management practice, it is not the first step when preparing to administer a medication to a client. A nurse is legally responsible for the safe administration of medications. Therefore, the nurse should assess if a medication prescription is reasonable. However, this is not the first step when preparing to administer a medication to a client.
The nurse is assessing an older adult with a pacemaker who leads a sedentary lifestyle. The client reports being unable to perform activities that require physical exertion. The nurse should further assess the client for which of the following? 1. Left ventricular atrophy. 2. Irregular heartbeats. 3. Peripheral vascular occlusion. 4. Pacemaker placement. The correct answer is 1. Left ventricular atrophy. Rationale. In older adults who are less active and do not exercise the heart muscle, atrophy can result. Disuse or deconditioning can lead to abnormal changes in the myocardium of the older adult. As a result, under sudden emotional or physical stress, the left ventricle is less able to respond to the increased demands on the myocardial muscle. Decreased cardiac output, cardiac hypertrophy, and heart failure are examples of the chronic conditions that may develop in response to inactivity, rather than in response to the aging process. Irregular heartbeats are generally not associated with an older sedentary adult's lifestyle. Peripheral vascular occlusion or pacemaker placement should not affect response to stress.
The nurse is assigning clients for the evening shift. Which of the following clients are appropriate for the nurse to assign to a licensed practical nurse to provide client care? Select all that apply. 1. A client with Crohn's disease who is receiving total parenteral nutrition. 2. A client who underwent inguinal hernia repair surgery 3 hours ago. 3. A client with an intestinal obstruction who needs a Cantor tube inserted. 4. A client with diverticulitis who needs teaching about take-home medications. 5. A client who is experiencing an exacerbation of his ulcerative colitis. The correct answers are 2. A client who underwent inguinal hernia repair surgery 3 hours ago, and 5. A client who is experiencing an exacerbation of his ulcerative colitis. The nurse should consider client needs and scope of practice when assigning staff to provide care. The client who is recovering from inguinal hernia repair surgery and the client who is experiencing an exacerbation of ulcerative colitis are appropriate clients to assign to a licensed practical nurse, as the care they require falls within the scope of practice for a licensed practical nurse. It is not within the scope of practice for the licensed practical nurse to administer TPN, insert nasoenteric tubes, or provide client teaching related to medications. When attempting to administer a 10 p.m. sleeping medication, the nurse assesses that the client appears to be asleep. Which should the nurse do? 1. Withhold the drug. 2. Notify the primary healthcare provider. 3. Awaken the client to administer the drug. 4. Administer it later if the client awakens during the night. The correct answer is 3. Awaken the client to administer the drug. Administering a medication is a dependent function of the nurse. The prescription should be followed as written if the prescription is reasonable and prudent. This medication was not a PRN medication, but rather a standing prescription. This is a violation of the primary healthcare provider's prescription. Drug administration is a dependent nursing function. Notifying the primary healthcare provider is unnecessary. The drug should be administered as prescribed, not at a later time. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is caring for a patient with peptic ulcer disease. Which assessment finding is the most serious? 1. Projectile vomiting. 2. Burning sensation 2 hours after eating. 3. Coffee ground emesis. 4. Board-like abdomen with shoulder pain. The correct answer is 4. Board-like abdomen with shoulder pain. Rationale. A board-like abdomen with shoulder pain is a symptom of a perforation, which is the most lethal complication of peptic ulcer disease. A burning sensation is a typical report and can be controlled with medications. Projectile vomiting can signal an obstruction. Coffee ground emesis is typical of slower bleeding, and the patient will require diagnostic testing.
Which of the following is not a risk factor for the development of atherosclerosis? 1. Family history of early heart attack. 2. Late onset of puberty. 3. Total blood cholesterol level greater than 220 milligrams per deciliter. 4. Elevated fasting blood glucose concentration. The correct answer is 2. Late onset of puberty. Rationale. Late onset of puberty is not generally considered to be a risk factor for the development of atherosclerosis. Risk factors for atherosclerosis include family history of atherosclerosis, cigarette smoking, hypertension, high blood cholesterol level, male gender, diabetes mellitus, obesity, and physical inactivity.
A nurse gives a client in a nursing home a choice about which color shirt to wear. Which level need, according to Maslow's hierarchy of needs, has the nurse just met? 1. Self-esteem. 2. Physiological. 3. Safety and security. 4. Love and belonging. The correct answer is 1. Self-esteem. Rationale. Choosing which color shirt to wear provides a person with the opportunity to make a choice and supports feelings of independence, competence, and self-respect, which all contribute to a positive self-esteem.
The nurse is providing the immediate postoperative care for a patient who had fundoplication to reinforce the lower esophageal sphincter for the purpose of a hiatal hernia repair. What is the priority action in the care of this patient? 1. Elevate the head of the bed at least 30 degrees. 2. Assess the nasogastric tube for yellowish-green drainage. 3. Assist the patient to start taking a clear liquid diet. 4. Assess the patient for gas bloat syndrome. The correct answer is 1. Elevate the head of the bed at least 30 degrees. Rationale. The primary concern in the immediate postoperative period is the potential for airway complications. Elevating the head at least 30 degrees decreases the chance for aspiration and facilitates respiratory effort. The other options are also correct, but will occur later in the postoperative period. The ABCs, airway, breathing, and circulation, underlie the priorities of care when the patient has an invasive procedure. You can use the concept of gas exchange to answer this question, even if you are not familiar with the specific details of the procedure.
The nurse is developing a teaching plan for a client who will be starting a prescription for Zocor, simvastatin, 40 milligrams per day. The nurse should instruct the client about which of the following? Select all that apply. 1. Take once a day in the morning. 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 3. Limit greens such as lettuce in the diet to prevent bleeding. 4. Be sure to take the pill with food. 5. Report muscle pain or tenderness to your healthcare provider. 6. Continue to follow a diet that is low in saturated fats. The correct answers are 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 5. Report muscle pain or tenderness to your healthcare provider. And 6. Continue to follow a diet that is low in saturated fats. Rationale. Zocor, simvastatin, is used in combination with diet and exercise to decrease elevated total cholesterol. The client should take Zocor in the evening, and the nurse should instruct the client that if a dose is missed, to take it as soon as remembered, but not to take at the same time as the next scheduled dose. It is not necessary to take the pill with food. The client does not need to limit greens. Limiting greens is appropriate for clients taking Coumadin, but the nurse should instruct the client to avoid grapefruit and grapefruit juice, which can increase the amount of the drug in the bloodstream. A serious side effect is myopathy, and the client should report muscle pain or tenderness to the healthcare provider.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.